The FMCSA, along with the DOT, provides specific responsibilities for employers when it comes to drug and alcohol testing of CDL employees. First, the managing of testing lies with the employer. This means employers are responsible for the actions of their employees and any other representatives concerning drug and alcohol testing. Employers have the right to use any outside agency they want to collect samples, perform analysis, and determine the outcomes of the testing, but they are still responsible for the requirements and procedures. For example, if a lab fails to follow the correct process or a result is incorrectly reported, the responsibility falls on the employer, as they are ultimately responsible for complying with regulations. Failure to do so could result in civil penalties. To help prevent this, the FMCSA gives employers guidance on the drug and alcohol testing process. All CDL drivers operating commercial vehicles on public roads are subject to drug and alcohol testing, including full-time, part-time, intermittent, backup, and international drivers. Employers are responsible for ensuring that all testing is completed for pre-employment, randomly, with reasonable suspicion, and for return to duty. Post-accident testing is necessary following certain guidelines depending on the type of accident. Fatal accidents, and those where a citation is issued to the driver, require the employer to perform drug and alcohol testing. In addition to the drugs previously discussed, DOT regulations give employers the right to test for other drugs under a non-DOT testing program. This employer-based testing program must be in addition to the DOT testing requirements, and drivers need to be informed in writing of non-DOT tests, including what drugs will be included, the concentration cutoffs for each of them, and the consequences to the employee if the testing has failed. Random drug tests should be conducted at least quarterly following the selection rate set forth by the DOT agency. The employee should be notified privately when testing is required either through random selection or because of an accident or suspicion. Once notified, the employee needs to go to the testing site immediately without stopping off at lockers, break rooms, bathrooms, or other areas. It's best practice for them to be accompanied to the testing site if possible. If an employee fails a drug or alcohol test or refuses to comply with testing requirements, they must be immediately removed from work and be provided with a list of SAPs for follow-up. Drivers can't return to work without a negative test, an SAP developed plan, and completion of the return to duty process. Termination is left up to the employer following their set policies and procedures. Comprehensive drug and alcohol testing records must be kept for inspection and auditing purposes by DOT agencies. These records should include testing results and processes, return to duty policies, and proof of employee and supervisor training. Records need to be in a locked and secure location or password protected if kept electronically. The length of time records should be kept depends on the type of information. For example, negative results and alcohol results of less than 0.02 need to be kept for a year, while positive tests and ones with an alcohol concentration of more than 0.02 must be kept for 5 years. It's the employer's responsibility to ensure that CDL drivers are trained. Training should include, but not be limited to, contact information of people assigned to answer questions about the program, employee drug and alcohol testing requirements, when and how employees will be tested, an explanation of what constitutes a refusal to test, the consequences of refusing a test, and information on the effects of drugs and alcohol. Employers must also be trained on how to identify possible drug and alcohol use and reasonable suspicion.